Hi, it's your student nurse Monique here, and for today we will be talking about dengue. So, what is dengue? Dengue fever is caused by dengue virus from female mosquitoes, Aedes species, and it usually occurs in tropical and subtropical areas like the Philippines. Yes, it is spread by mosquitoes. Aedes aegypti in urban areas or cities, and Aedes albopictus in rural areas. These are also called the Asian tiger mosquitoes due to their prominent dots on their bodies and stripes on their legs. Did you know that in 2019 the country declared a national dengue epidemic due to rising cases? 500,000 were hospitalized and 12,500 were reported deaths according to the World Health Organization. So, there are two clinical findings for dengue. First is the classical dengue fever, where there is an abrupt onset of high fever for 3 to 6 days, which then subsides and reappears after 2 to 3 days. Second is the dengue hemorrhagic fever or shock syndrome, where the patient is prone to bleeding, restlessness, facial flushing, abdominal pain, low platelet count, and dehydration. What to do when these signs and symptoms occur? Don't panic, it's organic. When in rural areas, coconuts are everywhere. You can drink coconut water as it is very rich in electrolytes which can help with the dehydration. If severe symptoms occur, go see a doctor as you may need immediate medical attention. Blood transfusion may be performed when needed, especially when your platelet count is dangerously low. Here are some prevention and control tips for dengue fever. Yes to vaccine. There is a vaccine against dengue virus called CYD, TDV, or Dengvacia. This vaccine should be given in a series of 3 doses every 6 months, and it is recommended to be given to those individuals who had previous dengue infections. Debunking myths. So some people say that vaccines will make us more sick. Vaccines can cause mild symptoms resembling those of the disease they are protecting against. Rather, it is the body's immune response. So vaccines usually contain live, attenuated, or weakened antigens that is being introduced to our bodies during immunization to awaken our antibodies. Hence, vaccines are safer than you think. Community awareness. Have you ever heard somebody say, throw the stagnant water away as they may cause dengue? The reason for that is virus-carrying mosquitoes usually resides on areas with stagnant water. So, one way for mosquito control is destroying breeding places and regular cleaning of surroundings. Aside from that, we must also be vigilant and alert of dengue cases in our community for awareness purposes. So there is no specific treatment for dengue. So we must do preventive measures like applying mosquito repellents, whether we're indoors or outdoors. Number one brand for this is the Off Lotion. We can also prep our homes with insecticides as fogging is now discouraged due to hazard issues. Screening our windows and doors can also be a preventive measure from inhibiting mosquitoes inside our homes. Number one of example is use of kulambos. So I hope you had some fun and takeaways. Thank you for listening. Bye bye.